I'm Mary, and this is Shannon. How are you?
I'm good. How are you?
I'm doing good. Thank you so much for taking some time to do this with me.
You're very welcome.
And so Shannon has been a Creighton practitioner for 9 years, correct?
Mm-hmm.
And a nurse for 25 years, almost 26 years. But she will soon be a nurse practitioner. Fingers crossed.
Yeah, God willing.
You're totally gonna make it. How much longer do you have left in school?
December.
December, okay. So it'll be here before you know it.
Yeah, see the light.
And that'll be cool because you can prescribe medicine
I can.
once that's finished. So very exciting.
Yes.
You might recognize Shannon. We did an interview with her just over a year and a half ago or so. Can you believe it's been that long?
Yeah,
It's been a really long time. But that video is actually, I rewatched it and it's really good. So I'm gonna attach it to this video. Check it out when you can because she goes into really good detail about how you can find a practitioner and a NaPro doctor close to you. Also, if you're long distance with Skype, I mean, they work with you. Also, all the cool information that they can pull from our charts, insurance coverage, and all the way down to like possible cancer detection in charts. We talked about, we got into everything you could want to know possibly about charting. We talked about, and it turned out really good. So check that out when you can. Today, we're going to be talking about miscarriage and postpartum depression, which I think is very interesting. Both things are pretty common, and there's quite a bit of difference that I've noticed with mainstream gynecology versus NaPro technology. My understanding is that it takes about 2 or 3 miscarriages for a mainstream gynecologist to order blood work and so forth. So what you see in mainstream gynecology, and then kind of talk about NaPro technology.
Sure. So when I got a nursing school, this was back in the 90s, I was a labor and delivery nurse. I did work at a teaching hospital, which was a fantastic experience.
Yeah.
I learned a lot there. And at the time, the estimate was that 1 in 4 pregnancies would end in miscarriage, 25%.
Which is a lot.
Yeah, that's a lot. The current statistic says 10 to 25%. So it's somewhere up in there.
Okay.
And one plausible explanation was that, those were probably just the babies that genetically had some kind
problems.
of aberrations. But I think we know differently now, at least we do with NaPro technology.
Okay.
So I don't know what the common belief, if that's still a common belief. And no doubt, I'm sure some babies who genetically aren't right do get miscarriage.
Of course, yeah.
But we know now that there are several other causes.
It's not that happening 100% of the time.
Right, every miscarriage is not due to a genetic aberration. And so, they, in mainstream medicine, because they're probably not aware of a lot of these causes yet, they, it's a statistic, it's you lose one pregnancy, it's not a big deal, you have a chance at another pregnancy.
It's kind of become accepted in our culture that, I had a miscarriage, it happens to a lot of women, and not thinking there's something that many of them can do to prevent that.
Right. Mainstream medicine really is not, there's not anything against them. I had a miscarriage my first pregnancy. I had a wonderful OBGYN, and he just said that, it happens, and you should have no problems getting pregnant and having a full-term pregnancy. And he was right. However, we do know now that some of that can be prevented. And like I said, he was a wonderful man and a wonderful doctor, and I liked him very much. I know he didn't know some of the stuff we've learned from NaPro technology.
Sure, and I mean, mainstream gynecology, nothing against them at all. They're great people with really great intentions. We just know that the research down the line before them just kind of stopped, correct?
Yeah.
So Dr. Hilgers, the creator of NaPro technology, or founder, I should say, he just continued this research to be able to find these extra things.
He did. A lot of the times the culprit of a miscarriage, we know now from NaPro technology, is it's from low progesterone, which can be evident in someone's charting if they're charting their cycles. So before even a miscarriage is experienced by a woman, it could be caught and potentially avoided if they're charting and we see those biomarkers or clues on your chart that show us that potentially you have low progesterone or fluctuating progesterone.
Right, which is it's such a simple thing.
It is.
Just to look at your chart and to be able to see something like that.
It is.
But you have to be charting and paying attention to the signs that your body is giving, the information that our bodies just naturally give to be able to pick that up.
And then, you know, once we see that on a chart, you can do some lab work. And if it's established, if the lab work shows that the progesterone is low, then you can be supplemented. And, you know, and we may have mentioned before, you may have mentioned in another podcast that NaPro technology only uses bioidentical hormones.
I was going to ask you, can you talk about how they supplement progesterone? Because isn't it come in different forms? Like orally, vaginally?
It does.
Can you explain how they, because I understand they find the way that your body absorbs it best, and that's the one they stick to?
Right. So first of all, we only use bioidentical because it's the artificial ones that their chemical structure looks very similar to our bioidentical progesterone and estradiol if needed.
You're talking about synthetic progesterone,
which would be progestin or medroxyprogesterone.
Is
like
that what's in
many
birth
different
control? Synthetic?
Yes, synthetic
hormones like that?
progesterones.
So
yes.
we're talking about something very different when you say bioidentical.
Right.
Natural.
Bioidentical has the exact same structure that our bodies.
So it's cooperating with your body. It's
right.
working
without side effects and other
and
adverse effects. Yes.
Right,
yes.
which is awesome.
Right. So and it works. It helps our body work the way it's supposed to work.
Yes.
In all aspects, not just in the target aspect.
Right, of course.
So, so the progesterone, there is a oral form called prometrium. It's microionized, which is just a term meaning that it's very well absorbed. But if a woman, sometimes women, and we are all so different.
Right, we're so unique.
Yeah. Some people still, even with the highest oral dose, still are not getting enough. So then there's vaginal suppositories, but I think even now they know that sometimes just the oral progesterone inserted vaginally is much better absorbed. But there are suppositories that are compounded. That's the thing, bioidentical. Besides prometrium, the oral form, bioidentical progesterone does need to be compounded, which is there's usually at least one compounding pharmacy in most places.
And if
nearby,
if not, they will mail it to you. I've used several compounding pharmacies that just mail me my prescriptions
from out of state.
Yeah, from out of state.
There's also, if someone they're still not getting enough, they can go to injectable. But I think they've gotten away, from what I understand, injections aren't, most of the time it's just in pregnancy that injection is needed.
Okay.
So basically I say in pregnancy, if a woman, progesterone is needed to support a pregnancy. If a woman starts out low with progesterone and she is on progesterone and becomes pregnant, most of the times the levels are monitored, but most of the time she will have to continue on the progesterone for at least part of her pregnancy, and it just depends on her levels. So then the progesterone at pregnancy, they used to almost automatically switch to injectable. I believe now they find that the vaginal, if the oral vaginal is keeping the levels sufficient, then they'll stick with that instead of going to injectable.
Okay, so that's the beauty of it, which I think is so cool, that we're getting ahead of it. Like, we already know before a woman may get pregnant if her progesterone is low. Because, and let me ask you, is it possible that if her progesterone is low, that she could get pregnant and miscarry before she even knows she's pregnant?
That is correct.
Okay, so say you're dealing with infertility or something, and you're not getting, you're not charting or getting your hormone levels drawn, you could be getting pregnant and just losing that pregnancy and not even know it.
Right.
So this is a really good way to stay prepared to, if that happens, maintain that pregnancy, and then as soon as you get pregnant, call your NaPro doc, and don't they get blood levels like right away? Because they don't want, if the there is low progesterone, again, miscarriages happen for other reasons, but if this is so easily prevented, naturally, in a way that cooperates with the body, it's just so helpful to know right away to be able to maintain that pregnancy. That's just crazy.
Yeah.
Do you remember statistics of the miscarriage rates with NaPro?
Oh, with NaPro? No. So if you're interested in that statistic, it's naprotechnology.com. There are little tabs on the side, and I believe one says miscarriage prevention.
There you
or
go.
multiple
That's
miscarriages.
true. A lot of information on this and all other topics. If you go to naprotechnology.com, you can find more information on that.
Yeah, and if you remember the whole foundation of NaPro technology is let's find what the underlying problem is, and then fix the problem, not just the symptoms, to restore to a state of health.
They call it restorative treatment
Restorative.
versus the alternative birth control or surgical treatments elsewhere, which is really kind of taking away or breaking down something.
Right.
So.
And you mentioned surgical, and you've talked about this.
Yeah.
NaPro technology definitely does utilize surgery
Yes.
for conditions that warrant it. There are, other reasons that miscarriages do occur. Not just low progesterone, but endometriosis, which typically requires surgery to help that out. There is a genetic aberration called MTHFR, which means that a woman's body cannot metabolize folic acid to its active form. If you remember, I don't know if you, most of the advice for prenatal vitamins and for women who want to get pregnant is to make sure you get enough folic acid. So these women may be getting enough, but their body can't convert it to the active form, so the baby can't get it. Folic acid is actually absolutely necessary for the developing baby, especially very early on. So, and those are tests that can be run that has a simple solution as well, with just specific types of vitamins.
To see if you have that MTHFR gene.
Yes. Well, it's a genetic mutation. Yes, and there's two different ones, but a lot of the NaPro docs are starting to test for it right away, especially if there's a history of miscarriages, but not necessarily, like they'll just run a test even without that.
Okay, good to know.
So there's, lots of causes, and I'm sure there are many unknown causes
Absolutely.
too, but these are some of the things we know. NaPro technology is wonderful in helping to find a lot of things.
Again, low progesterone is not, I should say, miscarriage is not the only thing that's affected by low progesterone.
Correct, absolutely.
Can you just name just a few things that low progesterone have the effect it has on us?
Sure. So just to go over the full cycle, like in the beginning part of the cycle, the ovaries or the follicle, anyway, the body's producing estrogen. And then in the second half, it's producing estrogen at a lower level and then progesterone at a higher level. In a healthy person, those hormones reach the correct levels, not only to support reproductive health, but they support breast health and bone health and cardiac health and emotional health. So even if a woman's not trying to get pregnant or whatever you're trying to do, you want those hormones in balance. A lot of what you hear about today is called estrogen dominance, and that is because a woman may or may not have too high of a levels of estrogen. Her estrogen levels may be normal, but she doesn't have that progesterone in the second end of the cycle to keep that estrogen in check. So that can give you symptoms like PMS, sore breasts, a lot of brown bleeding with your period, cramping. Low progesterone can definitely contribute to cramping.
What about mood?
Definitely mood, heavy periods. And the reason is estrogen causes the lining of the uterus to build up. Progesterone kind of levels it off. So if estrogen is allowed to roam without progesterone to keep it in check, the lining, the endometrium builds too thickly, and then when it sheds, it's very heavy.
Yeah.
So there are lots of things that progesterone is needed for, not just to avoid miscarriage.
I want to highlight that again. Even if pregnancy is nowhere near on your mind right now, it's still very helpful to be charting and getting this information if you need your blood levels drawn too to confirm, because you can still get supplemented if pregnancy is not on your mind, to improve your quality of life and just your health. It's about health in general. It's not all about pregnancy or, it's about maintaining a good, healthy body.
It is. Again, a lot of times low progesterone shows up in the chart. And even if you're charting, it isn't very evident in your chart. If you're having symptoms, then the doc will certainly write the orders for you to get tested.
Something you're not going to find outside of your NaPro technology doctors, correct?
Correct.
Especially if they wait till you have, a couple of miscarriages before they're even looking for your progesterone levels. This is happening way before that.
Yes.
So,
yes, it is.
Awesome.
Yeah.
Really quick before we finish, do you find that you see a lot of people with their charting, or that they don't think that they have any issues with low hormones or anything, and they're like, I'm fine, I don't need a chart, I don't have any issues.
Right.
And then they come in with their chart. Can you just real quick?
Sure. So, there's lots of people who don't think they have issues, and the practitioners, who are the people who teach you how to chart, are trained to recognize all those biomarkers on the chart. And so I'll tell somebody, I'm like, you have what we call variable post-peak basis, means that the time after ovulation varies by more than 3 days. And if it does, that can be an indication of hormonal instability. And I can say, whether you're having symptoms or not, I would recommend we can recommend to go see the doctor. Sure. And especially if maybe they're not pregnant yet, but they want to get pregnant in a year, I would kind of reiterate, well, you want this to be healthy, but also reiterate that healthy for pregnancy, but you want it to be healthy for you for all those other reasons.
You don't want to wait till you're trying to get pregnant and you're having issues to get this looked at or taken care of. Or say you're a young woman without any issues, well, that can change, right, with age. And so you want to be on top of that. Again, this is all about like being prepared, staying healthy for as long as we can, and catching things ahead of time if we have the ability to.
Yeah.
Cool. Well, thank you so much. I know I've learned a lot. I'm so grateful for you. This is my practitioner right here. So we get to hang out every once in a while.
Yeah.
And so anyway, please share this video and the information with your friends. If you know of anybody who's having these issues, subscribe on YouTube, follow us on Facebook and Instagram, and you can ask any questions at takingbacktheterms@gmail.com. Y'all have a great day.